Hello everyone, welcome to KNO Academy YouTube channel. So in this video we are going to continue the part 2. Okay, part 2 of NORCET-8 prelims MCQs. Okay, so in last video we have discussed 50 MCQs. Okay, exactly 50 MCQs. In the 3 questions are out of paper. So one is Jamaisu and another one is anti-TB drugs. Okay, and menorrhagia. Okay, so this questions included by mistakenly we have included. Okay, so that is also important only, no problem. Okay, this also very important for upcoming exams. And now after removing that questions I have again added around total minus 3 means 50 47. Okay, then 53 question extra I have added. Okay, so total in this paper, so we are going to explain around 100 MCQs. That is fully paper we are explaining. Okay, with MCQs and rational. Okay, so total 100 questions. So now today I am explaining 53 questions. Okay, okay, so we'll move to the first question. The traditional blood transfusion changed with the new techniques, which is the most effective and least complicated is. So this one question asked in the same NORCET-8 prelims. So answer is autologous. Autologous is, see how same person blood. Okay, suppose Mr. X. Okay, same person blood, they will draw the blood and reserve it and transfuse to him again. Okay, so this is the safest, okay, and most effective and traditional one. So right answer is autologous. Okay, we'll move to the next question. A 52-year male patient with COPD having saturation of 70%. Okay, so normal saturation should be 95 to 100. Okay, na normal persons. Okay, so in spite of giving 15 liter per minute of O2 via non-rebreather mask, NRB means non-rebreathing mask, the saturation is not improving. What will be the next action? So next action will be intubation. Okay, so we can't give up to 20 liters in NRBM. So maximum is 15 liter only. Okay, requestum is also that is not that much emergency. No, we cannot do that. BiPAP also will not work. So intubation will be the right answer. Okay, then next, the patient weighing 60 kg prescribed to give injection lorazepam 40 mcg per kg. The ampule contains 2 mg per ml. Calculate the total amount to be given. So this is the question asked in NORCET 8 prelims. Okay, the right answer. How to calculate this? Okay, so person weight is 60 kg. Okay, they asked 40 mcg per kg we have to give, like that they asked. So 60 kg means 40 mcg per kg means 60 into 40. So this is 2400 mcg we need to give. But the drug available drug is 2 mg per ml. Okay. So here we need to convert the mcg to mg. That is 1000. We should, this is the basic formula. 1000 mcg is equal to 1 mg. Okay, we all know this formula. Then what is the 2400 mcg is equal to 2.4 mg. This is very simple. 2.4 mg means 1 ml is equal to 2 mg. So 2.4 mg is equal to 1.2 ml. So 1.2 ml we have to take the drug. This is the right answer. Who are all answered 1.2 ml is right. Okay, so this calculation, hope you understood. Next we'll move on to the, this is the reasoning question, mental ability. So they have question D4, G7, J8. So like this questions we need to write in our paper, rough paper, so in that we have to write like A, B, C, D, A to Z we have to write, then 1, 2, 3, 4, 5, 6. Okay, like this we have to write. Okay, then you just match. D4 is equal to C. D is fourth, right? Okay, then J is seventh. So this is also right. Then J is 10. So this is also right. Then we need to see which one is arranged proper place. Okay, P15. P is 16. Okay, P15. Actually O is a 15. So this is wrong. Then O16, that is also wrong. P15, see, P is placed on 16th. So this is the right answer. Then Q is 18. No, Q is 17. So this is also done. Okay, hope you understood. Overall done. P16 will be the right answer. Okay, we'll move on to the next question. Choose the odd one out. Okay, D, F, H, J. Okay, M, O, Q, S. 1 minute. Okay, some electricity problem. Okay, so here, then D, F, H, J. Okay, D. Okay, D is the fourth place. So here also we need to write like this. Okay, then uh, F is after second place. Okay, second place. Then H is also second place. See, one by one it is, see, like this. Then A like this. Then J also like this. So one letter is missing inside. Okay. Then M O Q S. Here also M to O, one letter is there, and O to Q, and Q to S. Okay. So here also one letter is missing. And S U W Y. Here also same. S. Okay. S to U, same one. Then U to W, then W to Y, one. Then KLNP. KL, see here, this is not matching. KL is, okay, there is no gap between the numbers. So this is the, this will not belong to this group. Okay, this all one letters all inside we are arranging, but here there is no relation between these letters. Okay, then next question. So hope you understood this. Next question. If P is taller than Q but shorter than R and S is shorter than P, then who is taller? So who is taller, that we need to confirm. Okay. P is taller than Q means P will be highest. Okay. P, then Q. So he's taller than, less, shorter than P, but shorter than R. Okay. R will come here then. Okay. R will come here, and S is shorter than P. Okay, same here also. So S we can write here. Then who is taller? Taller is R. Okay, P is taller than Q but shorter than R. Okay, here we need to read twice. P is taller than Q but shorter than R. Okay, shorter than R. Taller than Q but shorter than R means, so R is the taller. Okay, then next, five people P, Q, R, S, T are sitting in a row. R is left to P, P is right to P, Q is left to S. Who is sitting in middle? Okay, so I will write here. First one, R is left to P. So this is left, this is right. Okay, so R is left to P means P here will come. So R is left to P. Okay, then P is right to P. So right means here, P is right to P. Then Q is left to S. Okay, Q is left to S. Sorry, Q will come here and S will come here. Okay, Q, S. Okay, then R, P, T, Q, S. It will come like this. Then who is sitting in middle? Middle will be T. Okay, T is the right answer. Then choose odd one out. Okay, so here I will show cactus, rose, lily, lotus. Okay, see here. So this is the cactus. Okay, so this is not a flower. Okay, so this is not a flower. So cactus, rose, lily, lotus is a flower, lily is a flower, and rose is a flower. But cactus is not a flower. So this is also one type of plant. Okay, but not belongs to this tree. Okay, so odd one out means we have to take cactus out. Okay. Next, which is the most abundant gas in the atmosphere? Okay, that is the nitrogen. So this question also we have asked in our test series. So around 78%. Okay, with the nitrogen will be in the air. Okay. The next question. Choose odd one out again. Inch, yard, kilometer. This all will be used for the to measure the length or distance. Okay. But gram is used for the weight. Okay. So this time they ask very simple questions in the non-nursing part. That's why I told you before exam day, don't ignore non-nursing. Okay. Don't ignore non-nursing. That's what I told you. Okay. So very easy questions. Then one more English grammar. If he dashed early, he would have caught train. Okay. If he had left, this is the right grammar. Right? Okay. So if he had left early, he would have caught the train. Okay. So this is the right answer. The next question. They will complete the work by next week. Make it a passive voice. Okay, the work will be completed by them by next week. This is the right answer. Okay, active and passive voice. Okay, then correctly spelled word. We need to identify the correctly spelled word. That is the one word correctly spelled is super said. Okay, then heart rate calculation formula. Okay, so who are done with heart rate of 150. Okay, with they have given ECG. Okay, two boxes. Okay, so here I'll show. Okay, so one box is equal to 300. So they have given two. So 300 divided by 2 is equal to 150. So how they will calculate? This is also one more formula. Okay, 1500 small squares is equal to 300 large squares. That one okay, small squares will be there now that they have calculated. Okay, so in we are taking ECG class also. Okay, by Shashi Kumar sir. So sir will explain very nicely. Okay, so regarding ECG sir will take class. Okay, then next question, growth chart interpretation. So question asked less than 2 standard deviation. Next, the height is 75 centimeter per age 3 years. Question asked. So what is the interpretation? So here it is there, less than minus 2 is for height per age. Okay, so is the stunted. So it is stunted growth. Okay, so for all written stunted growth is right answer. And idiom call it a day means to stop working. So this was the right answer. For all put call to stop working is the right answer. And we'll move to the next question. What is the order of lumbar puncture incision? So we are doing lumbar puncture. So this is a needle. Okay, so we can see here. So order of incision. Okay, so needle how it's going. Okay, so needle insertion. Okay, insertion. Okay, first will be skin, no? Then subcutaneous tissue, then supraspinous ligament, then interspinous ligament, then ligamentum flavum, epidural space, then dura, then arachnoid, then subarachnoid space. So subarachnoid space, okay, CSF will be there. Okay, done. Then next question. What is the current estimated total fertility rate? TFR means total fertility rate. Current data is equal to 2.1. 2 to actually 2 was there, so increase to 2.1. Okay, so 2.1 was the right answer. Overall put 2.1 is the right. Then find the abnormal value. So given some patient data, okay, patient history also they give. So these questions are the memory based question. So we cannot expect fully. We cannot, as per the NORCET paper, we cannot expect, but some questions we can expect. Okay, so all details we cannot included. So find the abnormal value. So here RBC lactate actually right answer is the lactate. How I will tell you. And RBS is 110. This is also normal. You will put 1.5 per kg. This is also normal. WBC also normal. Then how the lactate? So lactate normal is less than 2. 2 millimole per liter. So, but it is more than 5. So, this is the abnormal value. Okay. So, he need the treatment. Okay. Hope you understood. Then 67th question. A child with pyloric stenosis projectile vomiting. ABG values as follows. pH 7.55, PCO2 35, HO3. This is, so always in case of vomiting, okay, whenever vomiting happens, always, okay, metabolic alkalosis, okay, due to loss of H plus ions, okay. So hydrogen ions, metabolic alkalosis will happen. Vomiting always metabolic alkalosis. So who are all done metabolic alkalosis, that is the right answer. So for your reference, just I mean included the what pictures, okay. Respiratory acidosis. So ABG is a very big class. We'll take that also ABG in upcoming classes. Okay. Respiratory acidosis means pH will be decreased and PaCO2 will be increased. HCO3 will be normal. Then respiratory alkalosis, HCO3 will be normal, PaCO2 will be decreased, and respiratory alkalosis means pH will be increased. Okay. See, in metabolic alkalosis, same. pH will be decreased and HCO3 will be decreased. So PaCO2 will be normal. Metabolic alkalosis, okay. One more formula will come, Rome. Okay. Respiratory opposite and metabolic equal. So it's a very big topic. So I will explain in the next class. Okay. Then what is the difference between ABG and VBG? So in some cases, question was like this. Some cases, okay, whenever ABG is not available, so we can take the VBG. So what is the difference between how we can differentiate the ABG and VBG? So who are all working in ICU? So this complete paper, okay, complete paper made with ER, emergency, ICU, and OT. So I can tell you. So who are all worked in emergency, ICU, OT, they can easily attend these questions. Okay. So what is the difference between ABG and how it differs? So question answer. Show same oxygen. No, I will tell you how. Okay. Show different O2. Yes, this is the right answer. Then same O2 and CO2. No. Okay. Shows different. HB will be same. So I will show just on ABG. I will show again how it will differ. See, this is the ABG. So what we have to see means SO2. See, SO2 is the 92%. So this is the ABG value. Okay, always ABG value will be more than 90 will be there. So in this reference range also they given 95 to 99. Okay, 95 to 99. So more than 90 is the always ABG. Okay, if it is less than 90, it will be VBG. So we call PaO2, okay na, or SO2, saturation of inhaled oxygen. Okay, so that is SO2 we call, okay na, that is oxygen saturation will be more than 90 is the arterial blood. Okay, less than, so we can identify in SO2 only, see whether it is ABG or VBG we can include. Okay, then match the following. So here also we have already matched measles, cephalocaudal rash, chickenpox, pleomorphic rash, then scabies will be scaly rash, then heat rash will be itchy rash. Why heat rash means due to heat all our sweat glands are closed, so that's why itching will happen. Okay, this you have all studied in community. Okay, so heat rash only I'm telling. So itching will be there in heat rash. So this is already matched. Okay, so who are all done this, that will be right answer. Then question number 70, define massive blood transfusion. So this everyone knows. So more than 10 units PRBC within 24 hours is the right answer. So this is the wrong, this is the wrong, this is the right answer. So this is a very simple question, everyone knows. And most common complication of blood transfusion is the febrile non-hemolytic transfusion reaction. So always febrile. Then one more will come prolly. Okay, that is the late. Means transfusion react transfusion reaction, acute lung injury. Okay, so this is late, but is non-hemolytic. Okay, there is no hemolysis. Okay, this is the within short period it will come. So that's why it is febrile. So fever, what will be there means fever will be there. Okay, during blood transfusion, fever, chills, okay, some rashes. This is called acute non-hemolytic transfusion reaction. Okay, then identify the ECG findings. So one ECG figure they have given. So that is heart rate was more than 160. So SVT. This is SVT ECG. Okay, so who are all done with SVT is the right answer. Then you are teaching a patient regarding the deep breath, deep breathing technique. So which of the following is effective one? So they asked. So correct answer is allowing abdomen to rise. Okay. Only chest raise will not give the deep breathing. And lung expansion during inspiration, that is also not correct. So acute allowing the abdomen. Diaphragm should be expand. Okay. So that is abdomen also. So you can sit and deep breathe. Your abdomen will also. That is the deep breathing exercise technique. Okay. Then action of depot power 150 ml. This is also called antara. Who are all working in PHC, CHO, they all knows very well regarding this. Okay. So how it works means it's preventing the ovulation, thickens the cervical mucus and alter the uterine lining to prevent pregnancy. So this is the long acting contraceptive we can tell. So every 3 months one we are taking this injection. Okay. So regarding contraception also we can make one video. So no worries. Okay. So Antara is a how it action they ask only action of the Antara injection Depo-Provera. Okay. Then correct statement regarding the premenstrual dysphoric disorder. Okay. This one also we have already explained in the group. Okay. Emotional and physical symptoms they ask. Okay. Emotional is irritability and anxiety, depression, mood swings. Okay. Physical symptoms will be bloating, breast tenderness, and headaches. So headaches they ask, mood swings they ask, irritability, depression they ask, physical and emotional symptoms. Okay. So this is the right answer. Correct statement regarding the premenstrual dysphoric disorder. Then, according to the Rights of Persons with Disability (PWD) Act 2016, what is the percentage of benchmark disability required height? So it is that 40% is the benchmark disability. We call 40% is the benchmark disability, but required high support is the more than 70% is required high percentage. Okay, hope you understood. Then next question, according to IMNC guidelines, okay, it recommends what percentage of gentian violet to treat the oral thrush. Okay, oral thrush. This is the half strength, that is 0.25 percentage. Okay, full strength will be 0.5. Okay, so 0.25 is the half strength. Okay, then this is under wrong answer. Full strength we cannot give and better also we cannot give. Then next question, injection. This is the calculation. This calculations I have done in our YouTube channel. Okay, and last question also regarding which one, lorazepam, that also we have done in our YouTube channel. Okay, and injection diphenhydramine 25 mg is prescribed. Injection diphenhydramine 25 mg is prescribed for a client and available dose is 50 mg per ml. How many ml will you administer? Okay, this is the question. So formula should be D by H into Q. Okay. So D is equal to this. I have already done in our YouTube channel. So D is equal to desired dosage. Desired dosage. H is equal to drug in hand. Okay. Drug in hand. Q is equal to quantity. Okay. So D by H is equal to into Q. So desired dose, how much we want? 25 mg we need divided by available dosage is drug in hand. So 50. Primal means 1. So no changes in that. So 25 1 ja, 25 2 ja. This is 1 by 2. 1 by 2 is also known as point of. So 0.5 ml. So is the right answer. Okay. Oral done 0.5 ml is the right answer. The next ECG finding shows flared QRS complex, shortened PR interval, widened QRS complex. Seen in which condition they asked. In which condition we are seeing this. So this is a very beautiful image I have inserted. Okay, you can see here. So this is the O Parkinson White syndrome. Okay, so I can show this is the short PR. Okay, PR interval is short only. Then they call delta wave. We can see this is the delta wave. Then wide QRS. So I have already marked. Okay, wide QRS simplex. Okay, this condition will be seen in O Parkinson White syndrome. Okay, and next, when to discontinue the kangaroo mother care KMC. Components of KMC. Okay, so first you learn the components of KMC is the exclusive breastfeeding. Aims may ask in mains also. Okay, exclusive components very important. Components will be exclusive breastfeeding one and skin to skin, skin to skin contact. Okay, these are the two components of KMC. Okay, and benefits will be so many. Okay, so I will tell you in the next class. Okay, so right answer is 2.5 gram. That is the normal birth weight of Indian babies. So once baby reach 2.5 gram means 2.5 kg. Okay, 2.5 kg. So we can stop the KMC. Then a patient is in chemotherapy having platelet count of 25,000. Okay, what is the priority nursing intervention? See, this time all clinical questions only they have asked me. Overall, freshers wrote exam. They don't have the clinical knowledge, so it's very difficulty for them. Okay, so that's why I told in many videos. Okay, first you take the experience, or else if you have worked in your student time, okay, in your college, if you worked very well means so you can go for coaching. Okay, or else you can sit and study. No problem, no problem. But going coaching is very very important because what is right, what is wrong, they will tell you. Okay. Then what is the priority nursing intervention here? So monitor the platelet count is less than 44,000 is always okay na chances of bleeding. So bleeding. So we cannot uh, we have to monitor the bleeding tendencies. Okay, in this patient. Okay, so we can monitor the stool for occult blood. So if any malina or any flesh blood, okay, we have to check. Okay, fluid volume we have to give. Okay, anyways, okay, no? So that is important. Okay, anaphylactic reactions maybe won't happen. Okay, urine output also that is not an important thing in this. But because of platelet count is 25,000, bleeding tendency will be there. We have to monitor the okay tool for occult blood. Okay, this is the right answer. Then 82 question. Which immunoglobulin deficiency? So here they have asked clearly which immunoglobulin deficiency causes the plasma transfusion reaction. Okay, that is IgA. If deficiency of IgA means okay, plasma transfusion reaction will happen. But immediate actually many people were discussing IgE is the right answer. But anaphylactic reaction whenever it happens, IgE is a responsible. But here as they ask a deficiency causes means so the IgA is the right answer. Okay. Then what is the indicator that suggests magnesium sulfate MgSO4 has reached the therapeutic level? So here they have given clearly. Actually, magnesium sulfate always whenever we are giving for eclampsia patients. So this question all NORCET this question is repeated. Okay. So I have shared the actually protocol poster before exam I have shared, but who are all studied I don't know. Okay, we have shared. So in that everything is there. So respiratory rate 12 breaths per minute they are given. So if it is less than 12, so it will be the toxicity, but this is not. But knee reflexes plus 2 only. So this is the right answer. Okay, then decreased urine output. Okay, then increased heart rate. So decreased urine output if it is less than 30 ml. They have not mentioned here. Less if it is mentioned less than 30 ml per hour, that will be right answer. But first will be happen deep tendon reflexes. We call DTR. Deep tendon reflexes. It should be present. So with the knee hammer, we are okay na using our knee hammer. So knee, okay, we have to percussion. That is called percussion. So we have to do that. So if it is 2%, though it is already reached. So that is the reaching the drug therapeutic level. Okay. So overall answered knee reflex is right answer. Then National Deworming Day, that actually biannually we are using biannually in India. Okay, that is February 10 and August 10. Okay, so this is all wrong. Okay, February 10 and August 10. So with the albendazole. Okay, so February 10 and August 10 is the right answer. And a person having uremic disease, what will be the expected finding? So this is also very important. Flapping tremor. So this is also called asterexis. Asterexis. Okay, this is the condition. See, I will show. Suppose if anyone told us to hold our hand like this, okay, it will be fall down. So we cannot command or we cannot maintain the particular posture like this. Okay, so that's why I have given this image. Okay, it will be fall like this. So this is called flapping tremor. So this will be seen in uremic disease. Okay, due to kidney is unable to okay na remove the toxin. Okay, then it will be accumulated in blood. So that time it will happen. So it's also a very big topic. So we can discuss in further topic. Okay, flapping tremor is the right answer. Then, a patient with CKD and known case of diabetic mellitus having potassium value of 6.5 milliequivalent per liter. Actually, in this paper, they have asked two questions regarding the potassium. One is pre potassium is there, what will you do? So, we'll administer the K plus with NS. Okay, but here it is already overdose. What is the normal potassium? 3.5 to 5 or 5.5. Okay, based on some reagents what we are using it. This is the safest, but it is already reached the more than 6.5. Okay, so to save this patient is diabetic, that's why we cannot give dextrose also here, and bolus also calcium movement we cannot give. Okay, patient will arrest. Okay, then we cannot give diuretics also. Okay, because of CKD and calcium gluconate over 10 to 30 minutes, 20 to 30 minutes given an option. But usually we will give calcium gluconate 10 ml 10% over 10 minutes. This is the protocol, but this is not in the option. They are given 20 to 30 minutes. Okay, we can give, but dosage they have not mentioned, but time they have mentioned, so we can give. Okay, injection calcium gluconate slowly is the right answer. Okay, and match the following. This is already we matched. Okay, so placenta delivery, okay, is Brand Andrews maneuver. Then shoulder dystocia, Mac Roberts maneuver. Controlled head delivery, this is the Ritgen maneuver. Then breech delivery is the MSV maneuver. Okay, we have already matched. So for this you can take the screenshot in your YouTube channel. Okay, then first line treatment of OCD, obsessive compulsive disorder, is the fluoxetine. Okay, fluoxetine is the right answer. Who are done with fluoxetine is the right answer. Then hydrophthalamus is the most commonly associated with. This is the parvovirus B19. So this is also called fifth disease. Okay, keep it in your mind. So not rubella, not CME, not toxoplasmosis disease. Hydrophthalamus is associated with parvovirus B19. And match the following. Again, this match the following around 4 5 questions they ask. Oxytocin we use to induction of labor. So everyone knows. Okay, oxytocin is syntocin we call. Okay, then misoprostol for the cervical ripening. So one more drug will come, that is the dinoprostone gel. Dinoprostone gel. Overall worked in labor room. Okay, Serviprime. That brand name will be Serviprime. Serviprime gel. So that is the we are using for the cervical ripening or after induction of labor. So after giving the, if the cervix is not dilated, means we have to use the, okay, to ripen the cervix. So whenever pre, okay, premature, that time we are ripening the cervix. Okay. Then magnesium sulfate treatment of eclampsia, that is right. Then ergometrin, so it will be used to contract the PPH, contracting PPH only. Okay, ergometrin. So we are using during the, if PPH happen, so we will give to contract the uterus. Okay, uterus. Okay, so right, this already we matched. So you can see the right answer. Then this is the English grammar. Here once again English grammar question. She is annoyed by his behavior. So we should be thorough with English grammar also. She is annoyed by his behavior is the right answer. Then type of respiratory failure in COPD. Okay, so COPD is a which type of respiratory failure? So I will show you here. Okay, see, type 1 respiratory and type 2 respiratory failure. Okay, so two types of respiratory. The type 1 always hypoxemic. So in case of ARDS, okay, ARDS we call it as hypoxemic. That is the type 1 respiratory failure. Type 2 is hypercapnic. Okay, PaCO2 will be high in case of type 2 respiratory, but in case of type 1, O2 will be low, less than 60. Okay, O2 will be less than 60. This is the different. So this is also happening with COPD type 2 respiratory failure. So type COPD is a type 2 respiratory failure. Okay, then during CTG, okay, na, late deceleration of fetal heart rate indicates. Okay, outcome. So we know this wheel chop. Okay, so wheel chop you should remember always. Okay, variable deceleration means cord compression. Okay, early deceleration is head compression. Okay, then acceleration. Okay, acceleration is okay. Okay, then late deceleration is placental insufficiency. So here also this is okay. Okay, acceleration should be normal. Then late means placental insufficiency. Placental insufficiency, what we have to do? We have to give oxygen, or we can provide the left lateral position. Left lateral position, why we have to give, I will tell you here. Okay, here only I will tell you. Suppose, so uterus will be like this. Okay, so heart will be like this. Okay, so inferior vena cava. So it will come down. Okay, so whenever it will come now, so uterus will be there. Okay, inferior vena cava. So all, if she lie down on supine position, okay, supine position means this uterus will fall on the inferior vena cava. So this lower limbs blood will not flow to the heart. So that time supine vena cava syndrome will happen. Okay, supine vena cava syndrome will happen. That time placental. So blood loss will be there. That time even baby also will not get the sufficient blood. So that is called placental insufficiency. Okay. So here we can see wheel chop. So you can take a screenshot. This is very important. Every exam this question will come. Okay. And then next 94th question. According to NACP, okay, what is new target or guideline they asked? So this is the right answer. Promotion of condoms to prevent the STDs. Okay. Promotion of condoms to prevent the STDs is the right answer. The next question, psychotherapy for autistic child who love to play alone and having no social contact is play therapy. Okay, so he is play alone and having no social contact means we have to give a play therapy to him. Okay, then a child with nephrotic syndrome is being treated with steroids. What is the priority nursing care? So here we need to, so whenever we are giving steroids, we have to monitor the blood sugar. So whenever, if you work with a PICU or pediatric units, you will come to know. Okay, whenever we are giving steroids, we have to monitor the blood sugar before and after. And infection also, they are very prone to get the infection. That's why we have to uh, follow the infection control protocols and also monitor the blood sugar. Okay, A is the right answer. And so this is also psychiatric question. If I do something, okay, they have given some history, and so this is the statement. If I give something wrong, if I do something wrong at work, I will lose my job. So this type of thinking is seen in catastrophic thinking. So this is inevitable thinking, we call inevitable. Okay, so this is they very strongly they have believed this. Okay, that's so called catastrophic thinking, we call. Then 99. A mother infected during first trimester. Okay, this is the clinical based question. A mother infected during first trimester. This question also we have covered in our test series. Okay, then she delivered the stillborn. So keep it in your mind. Stillborn with large placenta. So large placenta means baby will be small. Then newborn form with shiny skin and rashes on the trunk. Okay, and dysgenesis of limb. Okay, so some deficiency in the limbs formation. Okay, and then what is the causative organism? So which infection during the first trimester happened? We need to see. Okay, so rubella, chlamydia, herpes simplex, varicella. So this is the varicella is the right answer. I will show why. I have inserted a C. Varicella. Okay. So how skin scarring will be there, limb deformities will be there, muscle defect will be there, low birth weight, okay, small head, blindness, intellectual disability. So this will be the okay na classical symptoms. Okay. So varicella is the right answer. Overall put varicella is the right answer. I think many people have done wrong with this. Okay. Then 100 last question. Bedside MMSC was conducted and the report is score 20. Okay, okay, they said 20. Okay. So what will be the finding? So this is mild to moderate cognitive impairment. MMSC. Okay, na? This is the maximum score is 30. I think psychiatry, this question also we have discussed in our test series. In our groups also many times we have discussed. So mild to moderate is the cognitive impairment, that is the score 20 denotes. And so here I will show, okay, 0 to 10 is severe and 10 to 19 is moderate, 20 to 25 is the mild, and 26 to 30 is the questionably significant. Okay, so this is the how to what interpretation of the MMSE score. Okay, and now so coming to next part. So we have already done, okay, release the test series, okay, in KNO Academy app. So for mains also we have released, okay, RRB also, mains also, and so we are planning to start crash course, that is also free in YouTube, free in YouTube. So daily, okay na. So I think tomorrow onwards we will start daily one topics, okay na? So our intention is to, and also for RRB, already we have covered many topics in non-nursing. Okay. So and only 10% topics are left. That also we will cover before examination. Okay. So don't worry regarding the non-nursing. So non-nursing we will cover in our YouTube channel. Okay. So this is the today's session. If you have any doubts still, okay. And also these questions we have collected. I have waited for 2 days and I have collected. Okay. If you have still any doubts, you can comment. Okay. So last three questions in previous part I have told and I have also commented and highlighted. Okay, so we have taken extra question because I have not attended the test, but I have collected from the authentic source and I have done the video. Okay, then how to we can how to study the mains. So I have already told. Okay, you can buy the and one more thing. This time we have got many questions from Mission Paricharika. So I will share the video. Mission Paricharika. Okay, Mission Paricharika. Okay, so PDF I will share questions around 90% questions came. Okay, mission Pracharaka and mission old papers. Okay, many questions I gave. So many people have already purchased. Okay, and also one more thing, KNOAB. I have discussed with the our authors of Mission Parijaraka. You apply coupon code KNOAB, you will get extra 5% discount. Okay, so order from Mission High Publications. Mission High Publications you can. So I will give the in description part. Okay, if you have any doubt, you can contact. Okay, thank you.